We come now to the last video on diabetes. What are the metabolic changes in type 2 diabetes? Are they different from the metabolic changes in type 1 diabetes? You just have to remember that they are basically the same. In type 1 diabetes, there is no insulin. Here, there is little insulin and there is insulin resistance. So we have, of course, the hyperglycemia and we have the dyslipidemia that we saw in the type 1 diabetes. What is different here? Ketoacidosis is minimal or absent in type 2 diabetes. Why? Because we still have some insulin. So even in the presence of insulin resistance, the little insulin that is present in our body will diminish the hepatic ketogenesis. Also, something else is different here. We usually see low levels of HDL. So low levels of HDL, remember this is the good HDL. These low levels of HDL are associated with type 2 diabetes. You have here a similar diagram to the one that we saw before for type 1 diabetes. So exactly the same scenario, except that the pancreas is making some insulin and that we have some insulin resistance. Otherwise, everything else is the same. And as I said before, you don't usually see ketoacidosis, so there is some ketone bodies production. You see ketoacidosis only in severe cases of type 2 diabetes. How do you treat type 2 diabetes? So the treatment is different. Here you have to give the patient some drugs, hypoglycemic agents, to control their blood sugar. So drugs such as metformin. What does metformin do? It decreases gluconeogenesis. So this is how metformin works. It decreases hepatic gluconeogenesis. And sulfonylureas, what do? They increase insulin secretion. Can you give these drugs to type 1 diabetic patient? No. You have to give him insulin. What is also very important in the treatment of type 2 diabetes is weight reduction. So you will advise the patient to do a weight loss regimen. They need to go on diet. And they need to exercise. So basically what I call eat less and exercise more. And they have to be careful in their diet by eating less sugary product. In severe or advanced cases, you might need to give your patient insulin therapy. I will not ask you to remember the name of these drugs. Let's leave them for the POD course next year. What are the complications of diabetes? So even with the therapy, even with treatment, you will not be able to completely normalize the metabolism of a diabetic patient. So what's happening? You're having a constant elevation of blood sugar. So all this sugar sitting in the blood of this patient, what will it do with time? We have a very important biochemical reaction that occurs. We have a non-enzymatic glycation of the cell protein, of the cellular protein. So these proteins in the cell, because they've been exposed to too much sugar, too much glucose, there will be non-enzymatic glycation of these proteins. They will have sugar added to them, and this will lead to the damage of the blood vessels. The good news is that you can prevent type 2 diabetes. Of course, you cannot prevent type 1 diabetes, but you can prevent type 2 diabetes. So if you detect the type 2 diabetes in a pre-diabetic stage, if the patient sticks to heavy exercise and weight loss regimen, they will be able to prevent type 2 diabetes from occurring. This diagram shows the effect of weight gain on the incidence of type 2 diabetes. So as the body mass index increases, the incidence of type 2 diabetes increase. And you can see here that this is the highest risk in patients with greater than 26 BMI and who do little exercise. So BMI has the greater effect on increasing their risk of type 2 diabetes, but also exercise. And with exercise, you can reduce the risk. And of course, exercise is more important in obese individual than in normal weight individual in reducing the risk of type 2 diabetes. I put here for you a comparison of type 1 and type 2 diabetes. You might want to read it later. It's a nice summary for you to remember all the difference between type 1 and type 2 diabetes. And to conclude, I would like to talk about gestational diabetes. What is gestational diabetes? It's a diabetes that developed during pregnancy, because gestation is the other word for pregnancy. So gestational diabetes will cause hyperglycemia that will affect both mother and baby's health. One of the consequences of gestational diabetes is having a large-sized baby, and we call this fetal macrosomia. Why do you think a woman with gestational diabetes will give birth to a big baby? Because of the anabolic effect of insulin. So anabolic effect of insulin will lead to fetal macrosomia. Another risk that diabetes or gestational diabetes for the baby is that the baby might be born with hypoglycemia. Why the baby is born with hypoglycemia? Because all that time in the womb he was exposed to too much sugar, and that's why he needed to make more insulin than normal. And when he's born, there's shutdown of exposure to this too much sugar, and he's still making too much insulin, so he needs some time to adjust to this lower level of insulin before his blood sugar normalize. In this last slide, we have a concept map comparing type 1 and type 2 diabetes. We've covered all these concepts. What I want you to look at here is the prevalence of diabetes and its risk factor. This is, of course, the state population in the USA, American population. So type 1 diabetes is not very common. Okay, so what about type 2 diabetes? It's much more common. And obesity and insulin resistance, they are very, very common. 80 million American have obesity and insulin resistance compared to 10 million diagnosed with diabetes and 10 million which are undiagnosed, and we have only about 900,000 American with type 1 diabetes. So type 2 diabetes is much more common than type 1 diabetes. This is true for the American population, and I think it is true here for Saudi Arabia. With this, I conclude my videos on diabetes on mole. I wish you all good luck in your exam, and I'm sure you will all get great marks and you will have nice memory about this course. Best wishes to all of you. Good luck.